own words. I think if you can get Congress to tell the FDA that, I think you get rid of them without having to go through, I've talked to John Goodman and Vince Calviani and Bart and all those guys on Right to Try 3 years ago. They asked me to come down and critique them because I had some experience writing legislation through Congress for a couple of years. It was back in maybe Lincoln's day, but still. And the thing that I thought you'd look for is you'd like to find one little lever. Just get that lever. Not have to convince everybody. Don't fight them on well, I've got this guy and it's a peak. You'll lose that every time. Just say, all right, well, look, how about this rule? Cure as many people as possible, as quickly as possible. That's the right thing to do. You get that there may be some, variation that you can come up with. But something like that, I think, once you do that, you just make them start thinking about this. Is what I'm doing here is I'm curing people, or am I going to make them wait 10 years to cure?
And to your point, I think there are two versions of safety that the FDA needs to address, in which, to me, the version of safety that you really need the FDA for would be best exemplified. There was the issue with the Massachusetts compounding drugs, the steroids that they were manufacturing, which were contaminated by a fungus, and no patient would have a way of not knowing that. There was drugs. Bob, what were they? Do you remember what they were being given for, the types of procedures that they were? I believe it was for pain medications.
Pain medications.
Yeah, pain medications, and the compounding pharmacy accidentally contaminated these medications with a fungus. In a situation like that, that's the purest reason for the FDA to be here. For those of you that are not familiar with the history, the whole foundation of the FDA is based on what's called the Pure Food and Drug Act. That basically was to deal with the issues in the early part of the 20th century, where folks were giving out things like arsenic and lead and calling them medication, things that are occasionally found in Michigan's water supply, unfortunately.
No snake oil.
No snake oil at this point. And from a safety standpoint, that was the original reason for the FDA to be there. And we don't want to have contaminated substances. And to that point, remarkably, two areas that the FDA doesn't regulate at all that our patients end up having to take because we don't have the 15-year study drugs. FDA doesn't get involved in the study and review at all with the safety of homeopathic medicines. And they don't get involved in the safety and the review of dietary supplements at this point. And I would say even the review of a few medical procedures. So for example,
a lot of surgeries are not subject, no surgery is subject to
and to your point, there's ironically a reason when we started G-PACT that there's a hyphen in G-PACT's web address. And why is that? Remarkably, there's a closely related organization that is not ours, that you can look up, that is at gpact.org, no hyphen, that is the lead authority in the U.S. that's trying to push colonic hydrotherapy, basically. And that is completely regulated by the FDA. And if there was a way, to your point, FDA is properly there to make sure that someone didn't contaminate a drug manufacturing plant with impure substances. That's why Pure Food and Drug Act is there at this point. The question becomes, and I've thought of this from time to time, be curious, NIH, I've gotten to know Chris Austin well at NCATS and NIH, and he's really become a champion of efficacy in clinical trials. Is there a way for NIH or NCATS or some either new federal organization or some new semi-private organization to take on and bring nuance to sort of the non-pure Food and Drug Act nuance sort of safety and efficacy?
The NIH is the last place you want to go.
Okay.
I don't know if I won't quote the name of the FDA official, but she said the NIH scientists couldn't open up a walnut if they had instructions. They're very good at giving out grants and doing basic research, but when it comes to medicinal chemistry, clinical pharmacology, designing clinical trials, even handling biosamples, they're horrible. You don't want the NIH involved. The NIH almost screwed up the Ebola trials because they insisted they wanted randomization in a
and the Ebola vaccine.
Random. So, I don't think that we'll see if. Yeah, exactly. Because Sierra Leone is, has state of the art. No, I think going back to Paul's point, you've got 11,000 members, and we could sequence everybody's genome for $1,000. We could go to Human Longevity, pick up the phone, call Bob Hariri, let's just do it. and then look at the microbiome, which they're also doing. And then let's hand it over to, we'll do it through transformative medicine. Let's do a deep dive of what's going on in everybody's gut. And I'll tell you something else. You'll probably find out that there's certain targets or ways to treat these things that, for example, has anyone tried central vagus nerve stimulation?
We have thought of that. That's
So-
worked in some patients.
Well, here's the, so a friend of mine runs a company that called Electrocore, and it's a non-invasive vagus nerve stimulator. And there's a lot of people who are using his device to take care of their epileptic dogs. So I'm thinking to myself, I said, well, I have a friend of mine who's got dystonia in the neck, she has Parkinson's. How do I get it to her? Because it's not approved for the FDA. Says, well, you should, if their dog has epilepsy, I could send you a device. And I'm going, what is it? So their dog Charlie is now having can use the device for this poor dog's epilepsy, and it's gotten better. So yeah. So but I guess the point being that once these targets become manifest, I bet you there are things that are on the market today. There are compounds that are that using combination can treat it. There's data that we can look. There are any number of drugs now for Crohn's disease, ulcerative colitis, that may be actionable, but we just don't know enough about the biology of the individual gut. But we can get there a lot faster than asking the NIH to hold to do an expert panel on gastroenterology and doing meta-analysis of all the data. Screw that. I mean, everyone just spit into a cup. I'll take it home today.
Well, what Cornell has started specializing in actually is the viewpoint now is we're dealing with what are at the end of the day peripheral small fiber neuropathies, and they've begun specializing. It used to be the gold standard back in the 90s. You would do a full thickness biopsy of the small intestine and large intestine, and then that's essentially a doorway to peritonitis, basically. You have newer technology in the form of a skin punch biopsy, basically, where you essentially take a hole punch a 3-millimeter chunk of skin, send it out to a lab for about a week or so, and there are certain inflammatory properties that you might see in the skin.
And I'm going to quote Jim Pinkerton again. Remember John held a conference on closing the gap.
We co-chaired.
We co-chaired it at the Cornell Club, and Jim Pinkerton spoke. And Jim talked about the power of the artisanal cheese lobby of the FDA. So it turns out that the FDA required artisanal cheesemakers to use metal trays instead of wood, which is because. So this regulation was issued. This guidance was issued. Now, who is the ranking senator from Vermont? Bernie Sanders and Patrick Leahy. Bernie Sanders and Patrick Leahy called up the FDA, and that's where a lot of artisanal cheeses are made. They called up their colleagues in Minnesota and Wisconsin on a bipartisan basis, and within 3 days, that guidance, which took the FDA 2 years to develop, was shredded. So if the artisanal cheese lobby can prevail, there's no reason why G-PACT, with big data and genomic sequencing, and can't prevail as well.
I think that you have some marching orders here, but in the interest of time, I just wanted to ask, does anyone in our audience have any questions?
I do. So the right to try, how do they determine what is terminal to the point that they can pursue this? Like both of my parents are fighting cancer, they're both terminal.
What is it your parents have?
My dad has GBM and my mom has multiple myeloma.
What's she on right now?
She's getting the Zometa. Is
she on Revlimid?
She's on Revlimid. She went from 70% to 5% in the time she was on, also went for the belly shots. the vape.
Okay,
She was on Velcade, she was having a lot of bad side effects.
she needs a combination, we'll talk.
Yeah.
But
Yeah, what's your
also, the
opinion?
doctors won't do anything special, because this is the protocol.
Right.
This is what insurance will pay for, even though they don't even wanna pay for it. You know, Dad had the radiation in his brain, which is causing other problems.
Yes.
So they're both terminal, but at what point is it the doctor that decides?
It's the doctor.
There's nothing else?
Yeah, it's the doctor, so you have to find a doctor who's willing to say, okay, these things are not working for you, Mom, you know, like, we see this is terrible for you, she's getting sick or whatever. And then to find something that is in phase 2 or 3 that either you guys identify or the doctor does, and probably that, and then a manufacturer who's willing to provide.
But also it's quality of life, right? Like,
Yeah.
so they gave Dad 9 months to 3 years, but, you know, not living much
They
more
gave
life.
my daughter 11 months, I got her on 6 compassionate care, she got 32 months. She would have had another 32 if I hadn't been so stupid on a couple of things. I've been a little smart, but 11, so, but every day of life is worth fighting for. And nobody can tell you today, you know, it's like Leon Panetta saying that this attack's going on for 7 rounds. They have no idea. They're giving you a bunch of averages. Don't give up the fight. There's lots of good stuff that you can
You know, when people say just, you have, well, just a month or just a few months, our friend Peter Bach, you know, manages the, nobody's average, and I know people, many people, who 20 years later, after being told they had a month to live, are still around, because every time they were told, well, that's it, there was something else.
Bobby
We
Topp.
just, what?
Bob Top, you're
Well, my friend Bob Tufts, multiple myeloma survivor, if he had been in England, he'd be dead, because Revlimid wasn't considered to be cost effective. But to the point, the faster we can move this cycle forward, you know, the longer more people will live.
So in your case, I would say obviously talk to Bob, because he knows all about what's cutting edge. Secondly, if you find a doctor who wants to try something that's phase 2 or 3, and you reach out to us, we'll help you through the legal, so that you can make sure, like, they're protected, you're protected, everybody's protected, because that's a big deal. And the third option that we really haven't talked much about is to look to Europe. There's quite a bit there. There's a really good company, I don't know if you know them, My Tomorrows.
Yes, yeah.
They are awesome. It's just mytomorrows.com. The founder lost his dad, even though he was running like a huge company. He was like, this is ridiculous that I couldn't get access to this drug.
Yeah.
My Tomorrows basically specializes in finding anything. They have a lot of special patients with like small, like orphan diseases and stuff, but anything that's cutting edge. And in Europe, compassionate use is more widespread, so they're matching the new products with the people who desperately need them, and they'll send you new alerts. So if you say, like, you sign up and say, like, Mom's got this kind of myeloma, they will send you alerts anytime there's something new, and you can possibly get care there too. So, and they may not have anything, but 30% of the most, like, the newest advances are coming out of Europe, so they might.
Drusky, following up on that point, do you think in your view, from a geographic legal standpoint, is Europe doing this better, is Japan doing this better, is Canada doing this better, from what you've seen comparatively?
Well, these guys can speak to getting things through the pipeline first. I mean, my understanding is they get a lot through, sometimes we're faster, sometimes they're faster. They're far better at compassionate use than we are. I mean, it's pretty widespread, and most of the insurers will cover your care. And, you know, we're not, I mean, that's like a 25-year-old system, so we're not remotely there. I'm helping people who are in dire circumstances, but they are, if you can get there.
And in Europe, is that union-wide or any particular country?
Every country is a little bit different, and that's the benefit of My Tomorrows, is they know, you know, the regulations in each place and what will apply to you, what won't, and so forth. But it's not, it's certainly not homogeneous, but it's close enough.
The general rule for the European Union, which is stated and, you know, written, like Rule 16 or something, is that member countries are urged to be particularly generous and open to treatments for people who have deadly diseases. And so it's much easier. I did a lot of work for Northwest Bio, and we had to go to Europe to get some things done because it was just too hard. The minute we go in, they kept saying, when I was working, they said, we had but they got a $5 million grant from the German government to accelerate. So, but it's much easier than clinical trials.
Right.
So,
There's in Germany, there's Dominic, the woman that we met from Germany, Liddy,
Belgium.
they're doing a combination of 10 different drugs for glioblastoma. Some of them are drugs, some of them are supplements, and there's sort of a whole underground of people using the...
We had 3 survivors.
Yeah,
Who were given less than a year to live. They're all
Yeah.
still here, 10, 15 years old.
yeah.
I wrote down a video you might want to look at, Surviving Terminal Cancer, and it tells the story of these 3 guys who put together their own. And you can follow them up in the European Union. They have clinical trials just beginning on that particular.
Thank you.
And Israel and Japan too are far ahead. I don't know where you begin and what the entry points are there, but they've got a lot going on too.
Yeah.
Well, I want to say,
Go ahead, Christian.
we're gonna wrap up.
Yeah, we wanted to, I know that a couple of our panelists might need to head out a little bit, and I just wanted to give folks an opportunity to give some closing remarks here at this point. Start out with Paul here.
The point at which this becomes unstoppable, I think it was Bob who used the example that you jump off on skyscraper, you survive once it's a fluke, you survive twice, maybe it's an aberration, you survive 3 times you're a pilot. And the ability for us to identify in the midst of these larger populations, go ahead and run your trial. We'll take Bob's suite of proteome, microbiome, all these things, and we will identify those patients, and let's see who identifies the winners fastest. And so I think that is the future. Bayesian medicine, database-driven medicine, is identifying these patients, and the magnitude of response you get in these patients. It's not like, oh, we're seeing a tiny little response. We're seeing a magnitude of effect. You don't see spontaneous remissions in metastatic cancer. They are extraordinarily rare. So if you can show a cohort of these patients, say, look, they respond to this treatment, they have these characteristics in common, then you've changed the game. And then you begin to blow up the entire RCT model.
I just don't think your group should wait another 10 years. You've waited 10 years too long. And after this is over, we should talk about how to work together to get a little tail.
Act up.
Yeah.
In terms of the 21st Century Cures Act, we've been covering it for a couple of years at Biopharma Dive, and based on the conversation with all of you, it seems that the one takeaway is the current FDA and the way the system is set up is definitely grounded in a 20th century philosophy, responding to a 20th century reality. And so it's inevitable that big data will change the way things happen, but I just hope that we don't lose too many people in the meantime, because that's what's happening. Every single day we're losing people because they can't get back together. So.
Yeah, I mean, I just want to say that by and large, I'm in agreement with all the panels, some of the things that they've said about the FDA and the need for reform, and the elimination of phase 2 and 3, and all of those things. And what we've seen is what you've seen, which is it just takes years and years and years to try to get the FDA to make any kind of a change. And I'd love it if Bob could hatch a cheese plan for you guys and what you need, but I mean, it's been 30 years since they've had a major reform there, and that's why we designed the right to try. Where we said we've got to take a different approach. What can we do vis-a-vis the states and those constitutions to protect patients and help their rights? And so that's how it was designed, and hopefully that's just the beginning for us. Then we can. You do under the U.S. Supreme Court have a right to self-preservation. You have the right to die in hasten your own death.
Yeah.
Against Frank.
But that's a circuit decision, and it's not binding. It's not
The
binding.
Supreme Court said that.
It's not binding. It's not binding, and so I have a whole chapter on the legality of this, but in the book, but the point is that we do have a lot of rights, and we've been fighting this in Washington, and that's great, and that needs to continue. But I think that we're going to be able to do more to protect patients' rights using the state constitutions the way we are with right to try. So we'll try to build on this, and this is it's not everything, but it's a good beginning when you're stalled in
I
Washington.
went through this once and was successful. I got rid of the ICC. And I said, I had Dr. John Meyer, who's head of Economics Department. And John Snow, who later became Secretary of Transportation, at that time he was the legal counsel for one of the very much Jesse or something like that. He had very big hitting guys. Cal Collier was one of our group, he became the FTC commissioner, chairman. So I'm a little bit leery. I love Galbiani and Goodman in this right to try because I think nibbling away is good. I think in the long run, it's a rear guard action by the enemy. And so
We'll race you to the finish line. I mean, I'm good with that. I mean, do everything you can in
That's- I feel the same
Washington, but
way.
people can't wait anymore.
Well,
And
look, I
that's
feel
the point
the
of
same
right to
way. I
try.
think you're doing great work. I'm just saying, I was urged yesterday by Al Newsell, I don't know if you know Al, said, why don't you join the right to try? Well, I told him, I think you're doing great. I want to go to the heart of the matter, the belly of the beast, I want to kill it. Because I went through this with the ICC, and a couple of times Sheila said to me, well, you did pretty good, John, why don't you stop now? We had a lot of rules changed. I said, they'll just come back. It's like, I didn't think of it at the time. It's just like a cancer remission, come back. So the only way to get this secretary Schultz, I called him George once, he almost killed me. It was 7 years later. The stare would have melted you, but no. I said, the only way we're gonna get this is get rid of him forever. And if I only thought of a good way to get them all employed somehow, it would have been a lot easier. But I
Well,
think
you can
that's what
ask
we
for
gotta do.
power back or you can take it back. And I mean, I think that that's what the states are doing and that we are forcing the FDA's hand. I mean,
Yeah.
last year when they came out, they said, at first they were saying, well, the compassionate use process is so easy, everybody can do it, which of
And now
course
they-
we all know is a big lie. Within a year, they came out and said, we got our first 5 states and they said, you know what, we are gonna turn that into a 45-minute form.
Yeah.
Okay, that was a sea change
Oh,
in the
you guys are
FDA,
doing
and they
great.
did it, but what I'm saying is that the state work is good in its own right, but it also shames them and it forces their
Yeah,
hand. So it's important
yeah.
that, you
And it
know,
builds legal precedent too.
it builds legal precedent,
Yeah.
and the best, you know, the best power to fight power is another power. And the states are incredibly powerful with state constitutions, so I would not underestimate our ability to
No,
force
I'm a
the
big supporter.
FDA's
I'm one of
hand.
the biggest supporters here. I love it. Keep it up. Anything I can do to help.
Well, here's the other analogy. I mean, you know, there now, you know, it was what happened at the state level that allowed people, you know, same-sex marriages. And then the Supreme Court ratified
So
it.
do you have a boyfriend in mind?
No, I don't, but I'm just saying that in general, it's like, those changes come from the states.
Well, look at
and,
medical marijuana, right?
Yeah.
20 states passed them, and then now the Obama administration isn't enforcing the federal laws anymore.
Yeah.
And they, you know, when the people speak, and that's why I said to Crystal, like, what patients do matters, testifying in those state houses matters.
a lot.
You know, the FDA is not deaf, and when they see 24 states pass a law in 2 years, they know change is coming.
It's a
So
political,
you have to keep up the pressure and the
Well, I
momentum.
hope you beat us.
we
I
know-
hope you- I hope you beat me here.
We know that right now that the FDA model is outmoded, it needs to go away. But like Darcy, I believe I've attacked so many things from so many angles, and if we're all working in
It's a
concert,
target-rich environment. This is
Yes,
like fight a
exactly.
I would just close with, first of all, want to thank everybody who's come this evening. It's, you know, terrific help, and these discussions really represent a terrific new starting point, not only for us, but for other folks in the New York area who were, you know, unable to join us tonight. Tonight's presentation has, you know, been filmed, and we're going to put it up on YouTube at, you know, at this point. But, you know, I want to speak to a second, not only for the folks that are here, but, you know, for the one thing that I might agree with Donald Trump on, and that's, you know, to the silent majority, as it were, at, you know, at this point. You know, that there are a lot of folks who couldn't join us tonight due to physical constraints and whatnot, but there are other folks who wouldn't join us tonight for fear of either participating in discussion or fear of having their voice heard, or, you know, fear that they'd be harmed in some way. And I'm I'm a history buff by background, and, you know, my dad was part of the generation, and, you know, Mr. Greenberg, who I work with, was part of the generation that, you know, fought against the Cold War. And I, you know, was a kid when the Berlin Wall came down, basically, and it took generations of folks. It took nearly, you know, took a good 25, 30 years, you know, for Spies to knock down the Berlin Wall at this point. But it had to start with a couple of bricks somewhere. And, you know, for those other patients that are out there that are afraid, for those other doctors and clinicians, we, you know, desperately need the clinicians to be part of these discussions, and we have desperate few who are part of these discussions to explain how they might put forward these protocols. This is not just a job for policymakers, but it's a job for the folks that are sitting on the ground. And if this is going to gain, you know, any power, there's going to be more voices, because, you know, I'll repeat what I said earlier. This is the largest minority in the United States, and this is everybody eventually. At this point, there's no bigger minority in that, and this is more than an economic issue. It really comes down to a civil rights issue at the end of the day. And I want to thank everybody for coming tonight, and I, really appreciate your
Thank you.
continued work.
Thank you, this concludes the formal portion.
Make a quick-